I love him, but you are both AS. Should we get married? Every year, many couples in Africa ask this important question. They face a difficult decision, whether to risk the future health of their children for a partner they love, or to sacrifice love in favor of health. While no one should have to make that decision, it is our current reality. Love is a beautiful thing, but having a child with sickle cell disease can put a huge strain on your relationship and on the well-being of the child. Good morning, ladies and gentlemen, and happy new month of love. Oh yes, my signatures remain Dr. Joe, a medical doctor and a health promoter. Welcome to a new episode of Your Health, Your Choice. Today, we'll be talking about an interesting topic that touches the young ones and leaves sequelae later in life in old age. Love or genotype? Which one is more important? In the part 1 of this video, we'll be looking at what sickle cell is all about. Why should people know about it? The causes, the risk factor, the symptoms, and the complication of sickle cell. Before we continue, I just want you to know that the purpose of this video is not to give you medical advice. No, rather, it is to give you information. And then with that information, you are able to understand and make choices that hopefully will make you to be more healthy and live longer and a happy life. So let's get started. According to statistics, millions of people around the world live with sickle cell disease. It is common. It is most common in Africa, in the Middle East, and in India. However, about 300,000 babies are born every year with sickle cell anemia. Most of the cases occur in Nigeria, in Democratic Republic of Congo, and in India. According to the World Health Organization, as high as 40% of people in some African countries have sickle cell trait. In countries with poor resources, more than 90% of children with sickle cell disease do not survive to adulthood. About 1,000 children in Africa are born with sickle cell disease every day, and more than half will die before they reach 5-year-old. About 20% of children with sickle cell disease in India die by 2-year-old. By 2050, the number of people with sickle cell disease will increase by 30%. That's how bad it is. So, what's genotype? Genotype is your complete heritable genetic identity. Apart from how you look, talk, and your blood group, your genotype, that's hemoglobin, red blood cell gene, is one of those things also passed to you from your parents. So you didn't choose your genotype, just as you didn't choose how you look when you were born. These cells are impaired in the body. You get one from your father and the other one from your mother when you are born, but you don't have power to choose the one you like. When you get married to and you start having children, the same process repeats itself. That is how God has done it. So, sickle cell anemia is one of a group of inherited disorders known as sickle cell disease. It affects the shape of the red blood cells, which carry oxygen to all parts of the body. Red blood cells are usually round and flexible, so they move easily through blood vessels. But in sickle cell anemia, some red blood cells are shaped like sickles or crescent moon. These sickle cells also becomes rigid and sticky, which can slow or block the blood flow actually. So, what are the causes of sickle cell anemia? Sickle cell anemia is caused by a change in the gene that tells the body to make the iron-rich compound in red blood cells called hemoglobin. So, hemoglobin enables red blood cells to carry oxygen from the lungs throughout the body. So, the hemoglobin associated with sickle cell anemia causes red blood cells to become rigid, sticky, and sometimes misshapen. For a child to be affected, both mother and father must carry one copy of the sickle cell gene, also known as sickle cell trait, and pass both copies of the outer form to the child. If only one parent passes the sickle cell gene to the child, that child will have the sickle cell trait with one typical hemoglobin gene and one other form of the gene. People with the sickle cell trait make both typical hemoglobin and sickle cell hemoglobin. So their blood actually might contain some sickle cells, but they generally don't have symptoms. They are carriers of the disease, which means they can pass the gene to their children. In humans, there are basically 4 genotypes. We have the AA, we have the AS, the AC, SS. The AA is the normal genotype. AS is a carrier, while SC and SS are the ones that can lead to having sickle cell disease. So, what are the symptoms of sickle cell anemia? Signs and symptoms of sickle cell anemia usually appears around 6 months of age. They vary from person to person and may change over time. Signs and symptoms can include 1. Anemia. Sickle cells break apart easily and die. So red blood cells usually live around for about 120 days before they need to be replaced in the body. But sickle cells typically die in 10 to 20 days, leaving a shortage of red blood cells. That's anemia. So without enough red blood cells, the body cannot get enough oxygen, and this causes fatigue. Episode of pain. Periodic episodes of extreme pain called pain crises are major symptoms of sickle cell anemia. Pain develops when sickle-shaped red blood cells block blood flow through tiny blood vessels to your chest, your abdomen, and your joints. The pain varies in intensity and can last for a few hours to a few days. Some people have only a few pain crises a year, others have a dozen or more a year. A severe pain crisis requires hospital admission. Some adolescents and adults with sickle cell anemia also have chronic pain, which can result from bone and joint damage, ulcers, and other causes. Swelling of hand and feet usually occurs in babies with sickle cell at about 6 months of life. The swelling is caused by sickle cell shaped red blood cells blocking blood circulation in the hands and the feet. Then they may also have frequent infection. Sickle cells can damage the spleen, increasing the vulnerability to infection. Infants and children with sickle cell anemia commonly receive vaccinations and antibiotics to prevent potentially life-threatening infections such as pneumonia. It may also have delayed growth of puberty because red blood cells provide the body with the oxygen and nutrients needed for growth. A shortage of healthy red blood cells can slow growth in infants and children and delay puberty in teenagers. They may also have vision problems. Tiny blood vessels that supply the eyes can become clogged with sickle cells. This can damage the retina, the portion of the eye that processes visual images, and lead to vision problems, such as visual loss. Now, what are the complications of sickle cell disease? Sickle cell anemia can lead to several complications, including number 1, stroke. Sickle cells can block blood flow to an area of the brain, causing stroke. They may also have complications such as acute chest syndrome. It's a lung infection or sickle cells blocking blood vessels in the lung can cause this life-threatening complication, resulting in chest pain, fever, and difficulty breathing. They may also have pulmonary hypertension. People with sickle cell anemia can develop high blood pressure in their lungs. This complication usually affects adults. They may come down with shortness of breath and fatigue, which are the common symptoms of this condition, which can be fatal. They may have organ damage. Sickle cells that block blood flow to organs deprive the affected organs of blood and oxygen. In sickle cell anemia, blood is also chronically low in oxygen. This lack of oxygen-rich blood can damage nerves and organs, including kidneys, liver, spleen, and can be fatal. They may also have splenic sequestration. A large number of sickle cells can get trapped in the spleen, causing it to enlarge and possibly causing belly pain on the left side of the body. This can be life-threatening too. They may also have blindness as complication because sickle cells can block the tiny blood vessels that supply the eyes. So over time, this can lead to blindness. Leg ulcers. Sickle cell anemia can cause painful open sores on the legs. Then there's this condition called Priapism. In this condition, men as well as boys with sickle cell anemia can have painful, purposeless, long-lasting erections. Sickle cells can block the blood vessels in the penis, which can lead to impotence over time. Then There might be also some pregnancy complications. Sickle cell anemia can increase the risk of high blood pressure and blood clots during pregnancy. It can also increase the risk of miscarriage, premature birth, and having a low birth weight baby. These are just some of the complications children as well as patients with sickle cell come down with, and it is a reason for recurrent hospital admission. At times, they cannot even describe the kind of pain they are having because it's terrible. The pain is so severe that at times they wish they were dead. Children asking their parents why they brought them into this world. They have to be on drugs for life. Some need chronic blood transfusion every time and then. Some need drugs but still they present to the hospital and they come down with crisis. Now, I'm sure you have an idea about what sickle cell is all about and why it is so important to prevent it. The first step to prevent this condition is by knowing your genotype. It is quite unfortunate that many people don't really know their genotype and they don't even bother about it until it's too late. If you carry the sickle cell trait, seeing a genetic counselor before trying to conceive can help you understand your risk of having a child with sickle cell anemia and your options in order to prevent it. Is there any treatment for it? Management of sickle cell anemia usually aim at avoiding pain episodes, relieving symptoms, and preventing complications. Treatments might include medications and blood transfusion. Is there a cure for this condition? Luckily, yes. The only cure is stem cell transplant, also known as bone marrow transplant. This procedure involves replacing bone marrow or damaged blood cells affected by the sickle cell anemia with healthy bone marrow from a donor. So the procedure usually uses a matched donor such as siblings who do not have sickle cell anemia. While stem cell transplant costs about $5,000 to $30,000 abroad. Out of 44 countries, African countries, stem cell transplant is only available in 6, which are Algeria, Egypt, Morocco, Nigeria, South Africa, and Tunisia. In Nigeria, it costs about 90 to 20 million naira. Now, we have come to the end of part 1 of this episode on love or genotype. Please stay tuned as you watch out for the part 2, where we'll be taking a look at compatibility table and various options for AS couple to get married and still break the sickle cell cycle, by not having children with sickle cell anemia. Thank you for joining me today. Don't forget to like, to subscribe, and to share. Thank you.